Hello and welcome, everyone. We're just going to wait about another 30 seconds or so for more folks to join us. Thank you. Hello and welcome, everyone. Thanks for joining us for today's training on training and supporting community members serving as interpreters. This training is presented to you by Switchboard, a one-stop resource hub for refugee service providers in the United States. My name is Tigges Coleman, and I'm the Senior Training Officer with Switchboard, and I'll be your facilitator for today. All right, here is a quick overview of your settings in Zoom. This is a Zoom webinar, so you are joining on listen-only mode. Due to the large number of learners that we have for today's webinar, we have disabled the chat box. However, you do have the option to send messages to the speakers and the co-facilitators via the Q&A box. We will answer your questions in the Q&A box throughout the presentation, and we'll also reserve some time at the end of the presentation to answer some of your questions live. Please keep an eye out on the chat for messages from Switchboard and links to various resources that we're going to be mentioning and sharing throughout. Today's webinar will run for 60 minutes and it's being recorded. You will receive an email with the recording, the slides, and the recommended resources within 24 hours. The transcript will be posted on the Switchboard website within a few weeks, since it takes some time to complete and comply with the web accessibility standards. So we appreciate your patience on that. Last, we ask that you kindly complete our webinar satisfaction survey at the conclusion of our session. This is a very short 3-question survey that helps us at Switchboard to continuously improve our training and our technical assistance offering to you all. With that, again, my name is Tigges Coleman, and I'm the Senior Program Officer for Training with Switchboard. I'm a licensed clinical social worker with over 20 years of experience working with refugees, immigrants, and other displaced population in various settings. I am joined with my colleague, Rosalie Arendt, who is in the background supporting with some Zoom logistics. I am delighted to introduce to you today our speaker, Rob Callus, who is a Switchboard training officer with a focus on community integration. He's a lifelong educator with several years of experience working in the instructional design, global health, and refugee resettlements. Rob previously worked with Refugees for World Relief, where he managed a youth services program. He speaks Swahili, and he also speaks Spanish, and he is ESL certified. All right, and before I hand it off to Rob, I also want to give a special thanks to Voices for Health, specifically Deborah Id, for supporting on this webinar. So thank you to Deborah, and thank you to Voices for Health. The learning objectives that we have for you today is that by the end of the session, you will be able to name key topics to cover when developing interpretation training for community members. We also hope that we can discuss considerations for working with community interpreters, including roles, responsibilities, boundaries, and ethical standards. Right. Well, before we get started, if you've attended any of our trainings, we love using our Slido interactive tool. Here, we just want to kind of get an idea of who is with us. So if you can take a minute to maybe scan the code that you see on your screen, or go to slido.com and enter the code that you see on the lower left of your screen, that would be great. And from there, please tell us how you describe your role. And there are some choices for you. And I see folks who are taking good advantage of that Slido. We have some resettlement agencies staff here. We have some community-based volunteer interpreters here. Welcome. We have some educators or other school staff. We have some healthcare workers, and we have some certified medical interpreters. Really great to see. Thank you all for your interpretation, or thank you for your participation. Thanks. All right, and now just another tool before I hand it over to Rob. We want to use this time to really kind of connect with you. Maybe ask you what questions you hope we will address in today's webinar. So if you can take a minute to either scan that code again, or if you open Slido on your web browser, it should still be open. So go ahead and type maybe questions you hope that we can answer for you. How to be transparent and professional, really good questions. And Rob, I hope you are taking note of some of these questions. Is there a certification course for interpretation? The difference between a translator and interpreter, really good questions coming up here. And please keep typing your questions. We will be able to see it and hopefully address it throughout the webinar. And as you're all typing in, I would love to use this opportunity to hand it over to my colleague, Rob. Rob, over to you.
Thank you so much, Tigist. And I love seeing some of these questions coming in. Lots of questions that I myself had when I was working in the field as a caseworker, and lots of focus on things of navigating challenging conversations. What is appropriate training? What are some really good resources that we can equip interpreters with? So I think these are some of the things that we're going to be discussing today. And I want to be really clear with a couple of disclaimers about the purpose of this training. All right, so first and foremost, we want to say that the most important thing, the best practice here, so to speak, is to work with folks who are certified interpreters. And so folks who have gone through medical interpreter training and certification and licensing and so on and so forth. We realize, however, those opportunities can be incredibly expensive and inaccessible for some folks, and that it may be more convenient and more just happens in the field that you're working with just regular community members who are multilingual, who want to volunteer their time or their energy, or have relatives who they're interpreting for. So we want to be really cognizant of the realities of working in the field and knowing that you may not be able to have that, perfect gold standard interpretation situation every single time. So our goal in today's webinar is to sort of provide you all with sort of standards and ethical guidelines for how to navigate some of those situations. And B, we're going to sort of talk through those tricky situations and hopefully provide you with some tools, resources, and language for how to move through some of those spaces in ways that are really client-centered, and really trauma-informed and really culturally appropriate. One other thing we want to say is that this webinar is going to have a ton of resources that we're going to be mentioning and a ton of places we're going to point you towards. You do not have to remember all of them as we're going. You don't have to be writing them down. We are going to send you all of these resources following the participation in the webinar. So no need to stress about those sorts of things. But if you see a particular resource of interest, do send us a question in the Q&A box. And if you have any questions about any of those resources as well, and we'll compile those and answer them throughout today's session. Last but not least, we at Switchboard do not have like a sample set training plan for working with community-based interpreters. There are a couple of reasons for that. One being it's not within the idea of, the best practice, like I said, but another reason is because the context really depends. So depending on who you're working with, where you are, different things are going to be important for different folks. So our goal is not to say this is the one way to train community interpreters. What we are going to share is a bunch of, what we can consider ingredients or different elements that we would encourage that you incorporate into your own training and onboarding for interpreters. So without further ado, let's move on to our first objective, which is naming key considerations for working with community-based interpreters. So I want to start by grounding us in sort of this quote from Title VI of the Civil Rights Act. Health and social service providers must take adequate steps to ensure that persons with limited English proficiency receive the language assistance necessary to afford them meaningful access to their services free of charge. So why I share this is to ground our conversation, like I said, in the legal right to services that mean that folks are receiving the information that they need in the language that they are able to receive it. So all clients who are receiving public benefits and social services are guaranteed access to interpretation. And it is our jobs as service providers to ensure that we are providing meaningful supports for folks to do that, right? So we have a duty, a responsibility to provide interpretation. So like I said, the best practice, but we also know that there are going to be other ways that we can provide this service. So really important to do this. So let's start by defining these key terms. One of our questions that we had at the beginning was about, what is interpretation? What's translation? What does limited English proficiency mean? So let's go through those definitions really quickly. So first, we have an interpreter. An interpreter is a person who converts a spoken or signed message in one language into a corresponding spoken or signed message in a target language. Now we're going to contrast that with our next definition of a translator. A translator is a person who converts a source text in one language into a corresponding message in a target language. Now, the key difference between interpreter and translator is that an interpreter might work with spoken or signed communication, and translators will work with written or, digitally text-driven sorts of interpretation jobs. So that will be spoken and signed versus text is the main difference. Next definition is limited English proficiency. So LEP is a level of English proficiency that is insufficient to ensure equal access to public services or benefits without language assistance. Now, there are a number of different ways that we might refer to people who are learning English or who are LEP or considered to be LEP. That might be an English language learner. That might be someone who's considered pre-literate in English. There are a number of ways to do that. We're going to try and stick with LEP as that can be more all-encompassing as a term. And that is what's written into law here. So before we talk about the topics, before we talk through some of our ideas for best practices and topics to cover, we wanted to ask you all, again, using Slido, so get those smartphones out again, or your browser open, and we want to ask you the question, when developing interpreter training, what are some key concepts and topics that you think are essential to address? What are some key concepts and topics? So imagine that you're sitting down and you're coming up with your own training plan and you're onboarding for your community-based interpreters. What are things that you think are essential? What are things that you think we should be covering? Effective listening, trauma-informed care, confidentiality. You'll notice it's a word cloud, and if people write the same response, it'll get a little bit larger. Boundaries, accuracy, neutrality, how to work with interpreters. Interpretation is never word for word, all right? We'll talk about that one. That's I want to stick a pin in that one. Ethics and power dynamics. I'm seeing a lot of ethics, neutrality, boundaries, accuracy. A lot of pieces about sort of cultural competency, understanding cultural differences. I'm going to give a couple more seconds for anyone who wants to continue adding a couple more. Someone had written to us also in a private message saying culture as well, right? We're seeing a lot of those pieces. Great, so you guys already have quite a number of these ideas, right? And what we want to do is we want to propose to you that, we're not reinventing the wheel here. There are standards in place. And so this slide here just has 9 ethical principles from the National Standards of Practice for Healthcare Interpreters. So these were crafted in the early 2000s and finalized in 2005. And we've just dropped in the chat a document that sort of lists out these 9 principles and sort of describes them, but also provides people with guiding questions to ensure that they are holding these ethical principles while engaging as interpreters or engaging with interpreters. Something I want to emphasize from this is, it might be something that feels less immediately, clear, but this idea of professional development is that interpreters are being really intentional about the ways that they're continuing to grow. It's important to note that just because someone is a speaker of multiple languages does not mean that they're necessarily going to be effective and skilled interpreters. I myself, when I served as an interpreter prior to doing my job at World Relief. And during that time, I had to learn a lot about what is the actual skill and art of interpretation. Just because I may be able to speak multiple languages doesn't mean I'm going to be able to communicate effectively across contexts. So we're going to talk about some of these ideas more in depth. And what we're going to do next is propose sort of, taking these 9 principles and seeing how they're interwoven, but we're going to propose them in terms of 3 major training topic areas. So we're going to go to the next slide. And here are our suggestions. So while we are not, like I said, providing exactly a step-by-step training plan, we are going to be going through each one of these and providing some key concepts to discuss and some resources that you can incorporate into your training plans when working with new interpreters or ongoing work with interpreters. So I'll also note that these 3 ideas were taken from one of our e-learning courses, Introduction to Working with Interpreters. That was a really helpful e-learning module for me when I was working in the field. And we wanted to sort of take those sorts of concepts and build on them as well and say, all right, how do we take those and move from theory into practice? So first, we have relevant terminology and accuracy in interpretation. So there are kind of 2 sides to this. One is the practice of interpretation. What are good practices and the mechanics of an interpreted meeting? But the second piece is really context dependent. So what is relevant terminology for folks who are interpreting in a refugee resettlement context, right? The next training topic area has to do with confidentiality and ethics. So there are a lot of things built into this, boundary setting, really clear roles and responsibilities, but most essential within that is really focusing on confidentiality and the ethical principles that come at play, especially considering we're working with vulnerable populations with very personal information. Last but not least is trauma-informed care. Again, this hits on things like boundaries, but it also has a lot to do with sustainability and how folks can continue providing services of interpretation in the context of resettlement where you're working with folks who have been traumatized. And we are all coming with our own experiences, biases, and traumas as well. So ensuring that we're being really clear and responsible with those as well. So like I said, we're going to break down each one of these, talk about key concepts, and we are going to provide indication of resources to look to. We're not going to drop those in the chat, but again, we're going to put those in a recommended resources doc. No need to scribble them down. You will receive them, but just want to talk about the kinds of resources to be looking at and to incorporate into your training plans. So first one, relevant terminology and accuracy. So the resettlement process has a lot of jargon and a lot of acronyms, as we all know. And it's really important to be clear about differences in verbiage. So for example, in one language, there might not be so many terms for different kinds of of migrants affected by forced displacement. For example, maybe the word for refugee and asylee in one language might not be very different. So it's really important to be clear with interpreters that they have a really clear list of words or topics that they should be sort of reviewing and preparing themselves for in case they have to have those conversations and be really clear about differences across language contexts, right? Also acknowledging that grant programs have their own language and verbiage, so making sure that folks who are serving as interpreters know what those grant programs are and what the stipulations are, and that includes other common public benefit programs that are accessible through human services departments. I want to harken back to one of the ideas that came in the Slido, this idea of word for word interpretation versus meaning for meaning. This is where, one of those ideas of being an interpreter can be really tricky, is that, it's not just necessarily going, like it says there, word for word. That might not actually translate the meaning as clearly, right? And it's just more challenging as an interpreter to go in that way. And you're going to drop a lot of meaning along the way. So it's really essential when going through the interpreter sort of practice to work with the caseworker that you're working with and make sure that you know what it is that the caseworker is trying to get across, and that you have the skills, the expressions, the language to get across that meaning. While a caseworker should know to avoid jargon and avoid euphemisms and expressions and things like that. That may not happen all the time. So an interpreter's job is to be able to navigate those sort of situations where there may be differences in context and verbiage and that sort of thing. So really important to be well-versed in good practices and as an interpreter. So a couple of resources to highlight. HIAS has a really great glossary of commonly used terms and definitions in the refugee resettlement space, including definitions of different grant programs and different kinds of forced migrants. We also want to highlight 2 Switchboard resources. We have a collection of resources for onboarding new refugee service providers that's sort of like a blog post resource collection. It's arranged by topic, and it might be really helpful to send some of those to interpreters, especially ones that have to do with case management, that have to do with trauma-informed care. We'll get to that one, of course, but interpreters who are working with newcomer clients should feel prepared to work in sort of this case management setting without providing case management services. So some of those resources in that blog post may be really helpful. And last but not least, being really intentional about some of these words like around the refugee resettlement process. And one of our videos, Who Are Refugees and How Do They Arrive in the United States, can be really helpful, can be really helpful for that. So that you have sort of like a way to prime your interpreters on the language they may be using in interpreted meetings. Our next training area that we want to focus on is on confidentiality and ethics. So in refugee resettlement work, like we're all in, we may be working with folks on very personal items. We're working with the history of trauma, history of migration, and a lot of personal identifiable information, and in fact, personal health information may come out that is essential to discuss in the context of client meetings. So it's really important that an interpreter serving as sort of a transmitter of meaning and information is knowing that the conversation that's happening stays there, that anything that they want to discuss about that afterwards cannot leave anywhere between the interpreter and the caseworker. So really important to protect the identity of folks, especially considering in a lot of communities around the United States, people are more connected than we may realize. And so even if you think that something may not be able to be traceable to someone else, you may not know of a connection that may exist. So it's really essential to stay as confidential as possible and to remove any mentions of personal identifying information, PII, as possible. And one of the ways we can do that is can provide interpreters with ways to have conversations about the work that they're doing because it's going to be meaningful. They may want to share it with friends and family, but providing them with roadmaps on how to have those conversations without revealing personally identifiable information. So for example, having interpreters, if they want to share with someone, talk about the ways that it impacted them without revealing any information about the call, right? Keeping things really focused on that can help to protect clients. Next, we want to talk about impartiality and neutrality, and we'll talk more about, conflicts of interest. But there's this piece where an interpreter's role is to sort of operate as a bridge between a caseworker and a client. They're not there to advocate for or influence newcomer clients in different directions, right? Often caseworkers may only be saying certain things in meetings because they are contractually obligated to share X, Y, or Z. And if an interpreter wants to share additional things, that is not in the role of the interpreter. That's something that should be discussed with a caseworker externally, definitely not in front of an interpreter, in front of a client. And that interpreter can come at it in a place of saying, I'm wondering why this was shared in this way. Is there anything that you can share that would help me in my interpretation and understanding of what the meaning is that we're getting across, right? So it's important to know that in the context of a client meeting, that interpreter is not operating as a caseworker. They're just trying to make sure that the meaning has been communicated clearly from caseworker to client and vice versa. Some suggestions in terms of resources that you can use. One, you can use those ethical standards that we shared prior as sort of like a guiding principles document for folks who are working with you. We also have 2 e-learning modules that we'd like to share, one from the University of Glasgow and one from MCIS Language Solutions. These are free opportunities They're fairly basic, but they can serve really, really well for basic accountability in terms of making sure that your interpreters that you're working with know these standards in place. Last but not least, for our third bucket of suggested training topic areas is trauma-informed care. All right, so there are a lot of key concepts that we want to talk about here to make sure that interpreters are being able to give of themselves without experiencing compassion fatigue or being able to steward their vicarious or secondhand trauma. And we're also we want to address things like re-traumatization. This is particularly important given that many community-based interpreters might be former forced migrants themselves, former refugees themselves, who feel the need to sort of give back in the community and pay forward with the sort of services that they received. So, however, while that is great and that's wonderful, we want to be really intentional with those interpreters that may have a history of forced migration themselves, that they know the possibilities of re-traumatization, what can happen, and what are ways that they can navigate those situations where triggering events may happen. So to cover some of these trauma-informed care basics with interpreters, we recommend a couple resources below. One, Blue Horizon has a particular webinar specifically focused on trauma basics for interpreters, which is really helpful. We also recommend that interpreters access resources more generally on what trauma-informed care looks like. And we've provided a webinar and a guide that we will share again in our recommended resources. So just to say, again, these three are suggested topics to incorporate into your training plans that you are developing. And we think that these are, bare minimum essentials to incorporate. All right, we're going to move into our second objective. Now that we've talked about some of the principles, the ingredients, we're going to start applying them and start putting them into practice by navigating these challenging situations. So Tigges is going to help me in this objective. We're going to have three sort of major case scenarios, and each one is going to have a different theme. And we're going to ask you guys to use Slido to answer how you would handle that situation. So let me turn it over to Tigges for our first case scenario.
Great, thanks so much, Rob. So this first case scenario is around quality of interpretation. So you're working for the first time with a community member who has served as an interpreter and whom your colleague recommended. As you proceed through a client meeting about housing options, you realize that the interpreter is speaking for long periods of time to communicate fairly simple and short statements. You do not want to interpret the meeting. You don't want to interrupt the meeting, so you let it happen. You later check in with your colleague who recommended that this interpreter and ask if they also witnessed this. They share that they mostly just assume the interpreter is sharing more helpful information, and they worry that bringing this up with the interpreter will offend them. So what would you do to ensure your clients receive quality interpretation? Again, we would love to see your answers on the Slido interactive. So Rosalie, if you can advance us to the next. Yeah, just looking at the case scenario, what would you do to ensure your clients receive quality interpretation? We'll give you a few seconds to sort of think through the answer, especially thinking about that case scenario of the community member who is who's helping you out. I see some answers coming in. Rob, you can feel free to jump in and maybe share anything that strikes you as some talking points for us.
Yeah, absolutely. I see a lot of things here asking about the experience and the qualifications of that interpreter. Is it possible that that interpreter is someone who, may not be super confident in either English or the target language? And is that why they're sort of talking a little bit more than you expect? Maybe they don't quite have the vocabulary and the language to do concise interpretation. There are some other notes I'm seeing in here about sort of like, oh, maybe they're just adding more feedback and, maybe it's helpful stuff, maybe it's not, but you as someone who doesn't speak the target language might not know. but I see some sort of ideas and solutions for corrections of saying, interrupting or pausing the interpreted meeting and just saying, hey, just want to remind that we have this policy of sharing the meaning as directly as possible. Double checking with the client can be really helpful here, although in a separate meeting with another interpreter. I think one of the things that's really challenging here is what do you do in the middle of an interpreted meeting like this, where it's just sort of feeling uncomfortable and you don't want it to get too far. You as a caseworker have the responsibility to the client to take a breath, take a pause, and just, you can even say that to the client, say, hey, we're going to take a pause really quick. I need to speak with the interpreter about something. And being able to say, hey, we have some standards that we need to fall back on. And this is just sort of a reminder. If that's the first time that the interpreter is hearing like word for word versus meaning for meaning or things like that, then that interpreter has been done a disservice and hasn't been quite onboarded right. So being able to be really clear about being able to pause and making sure that you're quality checking in the middle. One last thing I want to highlight from these responses is setting up time afterwards, one-on-one with the interpreter. This can often be uncomfortable to sort of question the interpreter in the middle of an interpreted meeting with the client. You don't want to sort of undermine them, right? So it may be more helpful to schedule time outside of a client meeting to sort of troubleshoot this. It's possible that you just might not have all the information about what was being discussed. So a separate meeting where you check in with that interpreter may be helpful here. So we want to provide, in addition to these great ideas that you've shared via Slido, we want to provide some other ideas for best practices in ensuring high quality interpretation. So first and foremost, like I said, if an interpreter is hearing this best practice in the middle of a client meeting for the first time, that has already done a disservice to the interpreter. So it's really important to start out by creating a standardized application and onboarding process for interpreters, right? So one of those things might involve evaluating prospective interpreters for language skill. This is something that can feel kind of uncomfortable at times, but it is really important to, especially if you standardize it, you can say, hey, we do this for all of our interpreters. This is something that is just standard. And if they're really confident in either of the languages, it can be really straightforward. So it doesn't have to be anything super intense. You don't have to search really far for this. You could come up with a list of 10 expressions, phrases, or sentences that you might commonly say in a resettlement context and work with another skilled interpreter that you know and trust and have them sit in with you and see, have them evaluate if the interpretation was done well. So one thing to add on this is that this is also not necessarily meant to be, a pass-fail sort of thing. This could be scaled in such a way that, let's say, a prospective interpreter gets, 5 out of 10 pretty well and then is pretty shaky on the others. This is a way that through the assessment, you might be able to identify gaps in their knowledge of content and terminology. And you might say, hey, I think you'd actually really benefit from taking this training course or reading this info guide. And then how about let's talk in a couple weeks and see if we can do the assessment again after we've done a little bit of practice. So it can be an opportunity for growth and professional development that way. But it's important to have that standard in place that you have to go back at and sort of serve as a guide in terms of informing your idea of if this will be someone who will be a quality and effective interpreter. So one other way to do this is to, if possible, offer opportunities to shadow other skilled interpreters, especially if it's a brand new interpreter, they've never worked with a client in this way, having them join for seeing another trusted and skilled interpreter do their thing might be really helpful, of course, with consent from the client and from the interpreter that they may be shadowing as well. Again, one of the most important pieces here is knowing that you as a caseworker, if you need to correct an interpreter or ask a clarification about what was interpreted, that is your role and your responsibility as someone in that interpreted meeting in order to ensure that the client is receiving, like we said, the meaningful access to services. So like I said, it can feel uncomfortable, but that is your role as a caseworker and to do so professionally, and you'll have standards in place to protect you in the event that you need to do that. So those are just some ideas there, among others. So thanks for that. We're going to jump to our next case scenario having to do with conflicts with neutrality.
All right, and this one is You work on a newcomer youth service program, and one day a school staff member reaches out to you asking why your newcomer client's family had not shown up for a meeting to discuss discipline and learning needs. The school staff member says they sent several communications to the contact information on file, which you realize belongs to a family member of theirs who often serves as an interpreter. You reach out to the interpreter and ask what they know about this matter. They confirm receiving the meeting notices, but they advise the caregivers to ignore the school messages because there was nothing wrong with their child. Again, back to that Slido interactivity. Looking at this case scenario, how should you navigate this conflict of interest in order to ensure your youth client is getting the support that they need? Again, we'll give you some time to sort of type or think through some of the answers. Give the school the right contact information. Let's see. Work with the interpreter who's not a family member. I know lots of ideas are going to be flowing in.
Bringing in an outside interpreter. Yeah, I think what's important here is that it can be really sensitive. Like this is something that, if you're involving a family member who has a personal relationship with the youth client, that might influence the way in which they're able to navigate situations where others are looking out for that client and trying to provide different services. So a lot of ideas about finding a different interpreter. And I'm sure that in this situation, as I experienced it in the past, and I'm sure many of you guys experience it, these family members are super well-intentioned and trying to be really caring and trying to be really helpful for a client family, their family members that might not be able to navigate the context in quite the same way. So they're trying to do their best, they're trying to be helpful, but it's your job as a caseworker who's also looking out for the client to ensure that they are receiving additional supports. It's possible also that family member might not have the time to be a really strong advocate for that youth client in the school. And so maybe that's one of the reasons why the communications have been sort of ignored. They're like, it takes too much time, too much energy. So providing an external interpreter, while challenging, is essential and can be very sensitively done in order to protect that client. So let's talk about some of the best practices here. Actually, Rosalie, could you go back one slide? I saw one answer that I really loved. Explaining to the family member that there's no judgment, that it's just a conversation, right? I think that's really important to also be clear with the person who is functioning as an interpreter in the family, affirming to them that they are doing something that's really helpful and affirming their intentions, but also being really clear about the rights and responsibilities that youth client has access to. That can be really helpful as well. All right, so let's move to the next slide. So sorry about that, Rosalie, but thanks for your flexibility. Some best practices with addressing conflicts with neutrality. The easiest thing here is avoid assigning an interpreter to assist a client that they may be related to. So again, while that's someone that they may feel comfortable with and someone who they may trust to serve as an interpreter, it's really important to be able to separate those sorts of things in order to ensure that folks are getting equitable services. So that also might involve having conversations with clients about the roles of interpreters that you work with, assuring them that they have signed or that they've agreed to confidentiality practices, that they've agreed to different standards that will protect the clients. That might be important to say, hey, we know that you trust your family, but we have someone here who really cares about your well-being and is going to be doing the best that they can to also ensure that you're getting the best outcomes as possible that you can get. It's important on the training side for interpreters to add some sort of space for conflict of interest discussion and protocol within the training process. Now, conflicts of interest can be screened at any point of a relationship with an interpreter. So one example of that is for any interpreted meeting that you're scheduling, it's important to have a briefing session. So before the interpreted call, if it's a non-emergency meeting, of course, to say, hey, we're trying to schedule this call or this meeting with a client about X. These are some of the words that we're going to be talking or that we'll be using to discuss this. Here's our goal for the conversation. Can you identify any conflicts of interest? Can you identify any areas of this possible call where you feel unable to serve as an interpreter? And that being asked as a non-judgmental way, often these are volunteers or contracted folks who have the right and responsibility to themselves to say yes or no to a gig, to an interpretation job. So being really clear and setting up that protocol of saying, here's how you can remove yourself from the situation. Here's where you can ask questions to sort of investigate if you'll be able to do the call well. Doing that with an interpreter and a caseworker in advance of a meeting can ensure that the meeting will be more protected and more secure and more successful. It's also important to do that afterwards as well, to have sort of a debriefing session and say, hey, did that go well? What were things that might have been challenging about that call? Are you okay continuing with this case if we have other needs? So being really intentional about screening for potential conflicts of interest in the future. Want to also affirm something about this last note, recruiting widely and contracting with other local agencies as needed. Sometimes this isn't possible in smaller communities. We want to be really cognizant of that. Even within that, there are some other best practices. There are language line solutions that you can use. There are mobile apps that are, not necessarily that gold standard best practice. But if it means that you're protecting a client and that you are bringing in an external interpreter who might be able to lead to a more positive outcome, that's ultimately going to be most helpful, right? So we acknowledge that there are barriers and challenges to recruiting widely and getting interpreters often in some communities, but we hope that you'll be able to identify some of those other solutions that can work for more extenuating circumstances. All right, we're going to move on to our next case scenario, and we just want to affirm everyone who's asking questions in the Q&A. We're going to hit on as much of those as we can in our time after the last case scenario, but just want to say keep those coming in.
Wonderful. All right, this is our last case scenario, and this is around roles and boundaries. You are the caseworker supporting unaccompanied refugee minor, URM, a client from Eritrea. During your regular monthly home visit, the client is acting unusually quiet when asked about their foster parents or their foster home. They say things at home are so-so. The interpreter you're working with shares with you her concern that the client is not doing well. The interpreter says that this is typical to use indirect language like so-so or okay, even when sharing a serious matter to remain respectful. They insist, the interpreter that is, that you take this matter seriously and perhaps move the client to a new home that is more culturally appropriate. All right, now over to the Slido one last time. If you were the caseworker, how would you handle the situation? It's a really tricky one, right? It's a culture to consider, the client and the interpreter that now you're having to deal with. So what are some considerations for you to handle the situation as the caseworker on this case? Again, we'll give you a few seconds to sort of get your thoughts out and type them out. And I see that coming in. Great. Thank the interpreter for the cultural information, but let them know that their recommendation may or may not be followed. I try to be professional, make sure that that from a professional perspective. I will like to talk with the client to know more about it, ask for more clarification.
Mm-hmm. Yeah, these are all, it's a tricky one, right? You want to take this seriously, and if someone who's operating as an interpreter shares the cultural context, you don't want to totally discount that. But you also want to be sure that, something tricky here is that in this situation, the conversation is primarily between the client and the caseworker, and the interpreter is sort of the bridge, right? Now, you've heard from the bridge that the client is doing poorly, but the client hasn't said necessarily that they're doing poorly. They said they're so-so. So not to say that we should be discounting it, but we do want to hear from the client more. We might want to ask more questions that might get at the heart of what does so-so mean, right? So this, in a way, is has a question where you are trying to create agency for the client themselves to self-advocate, right? If I'm sitting here trying to explain someone else's experience, I may say so-so means X, someone else might say so-so means Y. We want to be really intentional about, not ascribing our own experiences of something to someone else's experience, right? So that interpreter may or may not be right, but what's important is that the client is able to define their cultural experience as their own. They're not solely having someone else explain their context. So asking additional clarifying questions is really important. It's also important to acknowledge that if this is happening in a client meeting versus outside of a client meeting. So let's say in the client meeting, the interpreter is saying, oh, you're doing so poorly. We need to move your house. We need to move your situation. That does not sit well within the role of the interpreter and in terms of professionalism. But what would be more appropriate is if in a debriefing call, an interpreter who might have those hesitations or misgivings or worries or concerns should share it in that context and say, hey, this is something that I feel unsure about based on my cultural background and my come from. And so I wonder if we could have a follow-up call, or if you might suggest a follow-up call, even suggesting maybe even with a different interpreter to dig a little bit more into this, or to flag it for a follow-up meeting or something like that.
Rob, I also just want to note that certain programs and certain special clients require some sort of extra assessment. And in this case, I think whether your client is that URM client, there's also an opportunity for you to follow up with the foster parents to assess how things are going. So really noting that there are other elements and there are other folks within the vicinity of the clients that you can assess for more information. And I love one of the comments, or one of the answers here, really assess for more, and maybe avoiding assumptions, whatever that assumption might be from your role as a caseworker.
Yeah, absolutely. I really appreciate that, Tigas. Thanks for flagging that. And I guess like a last thing within this is that, a client who might even say that things are so-so, or might even go so far as to say that things are bad at home, might not actually be their concern might not be with something that is unsafe or untenable for a living situation. It might be about something else, or it might be something that's workable or, addressable without needing to go to a totally different foster parent situation. So the interpreter providing a solution to something that they haven't fully fleshed out or understood does not stay within the boundaries and role of an interpreter. And so maybe just more information is needed. So like Tigas, you said, reaching out to the foster family and getting a little bit more information from their side of how things are going might be most helpful. So within this case scenario, I wanted to talk about some additional best practices around defining roles and maintaining healthy boundaries so that we might avoid those sorts of situations. So we've redropped the national standards of healthcare interpreters. So we want to say here is that, again, we're not giving like a one-size-fits-all training plan, but these standards can be really helpful in reinforcing what roles and healthy boundaries look like in interpretation. So first, we want to check in with interpreters regularly. So in debriefing meetings, in briefing meetings before interpreted meetings, but also finding times periodically to check in with interpreters, especially those who are working more long-term on cases that might be more challenging, right? So it's also important to create group spaces with your interpreters so that they can gather, again, periodically to troubleshoot some of these things. So kind of the same way that we're all in this space going through some of these case scenarios, might be really helpful to pitch these sorts of situations to interpreters themselves and say, hey, knowing what we know about our ethical standards and practices, what is going to be best for navigating this situation? And folks can sort of share their experiences that way. And then you as a caseworker or someone who works with a lot of interpreters can sort of define like, here's our best practice, here's what we're going to lean on. Next, developing clear role descriptions and community-based interpreter agreements with a clearly defined scope can be super, super helpful. You have this accountability piece and you have all of these standards that have been communicated to and attested by community-based interpreters in advance. They know what they're getting into, they know what their standards are, and that will protect themselves and the clients that they are serving. Next, we want to highlight the benefits of healthy boundaries in social services. I know for many people in the field wanting to do really good things are super well-intentioned and want to just give and give and give, but we can be really clear with interpreters as well as caseworkers and other staff who are working in social services why we have boundaries and what they can be helpful for. Boundaries protect clients and all of us who are working in the space. We reduce harm that can be perpetrated. It can promote sustainability in the work by preventing burnout, and we can ensure consistent and equitable services, making sure that everyone's getting the same sort of services because we're staying within our roles and our boundaries, right? This, I want to sort of address one of these pieces, kind of a question that came up in the Q&A, the idea of advocacy and what is the role of advocacy for an interpreter, because that's in the 9 ethical standards, right? But we also want to make sure that interpreters aren't doing the sort of like additional advocacy within an interpreted conversation. What's important about advocacy as an ethical standard is that, basically, given the fact that someone's serving as an interpreter, that is an act of advocacy because that person is doing the work to provide equity in services. So they're saying, it's not right that someone may not be able to access a service without language access, and I'm here advocating for them, ensuring that they are able to get that access, right? However, we don't want that person who's serving as an interpreter to advocate for services that might not be feasible, that might not be accessible, or might not be provided for by a resettlement agency, by a health center, so on and so forth. It's really important to note that while we're trying to do things that advocate for and empower clients, we're also trying to make sure that we're not moving outside of our boundaries in that way. I was going to say more guidance about advocacy and goals within that can be found in the national standards, going at those sorts of guiding questions. If you're ever unsure if something is sort of dancing outside of what's within the boundaries of advocacy, refer to those, and those should center and ground and guide your practice there. Last thing on this slide that I want to emphasize is avoiding relying on a single interpreter. And this is a question that came up, and I think this can be really tricky and sticky, right? Because one benefit to working with the same interpreter in the same family in an ongoing way is that you're building trust between that interpreter and the client family. However, it can be really important for the client in some situations to know that like all of the people that you're working with as an agency with interpreters have the same standards that they've signed on to, and that they all have the interests of the clients at heart. That being said, you can always ask client families what their preferences are. You can say, hey, like we're gonna have this meeting, we're gonna have this doctor's appointment, we are going to have this interpreter join you. Any questions, feedback, that sort of thing. And if they have a bigger preference for one interpreter versus another, that's something that can be factored in and likely may not have negative effects, but what can be really helpful for interpreters themselves is to have them working across multiple contexts, because not to say that building those relationships is a negative thing, but if someone's being the sole provider for and it being seen as the sole interpreter for a client family, that can build in some challenging power structures and power dynamics that come into play. So it's not to say that we don't want clients getting close to interpreters, but we are trying to sort of decentralize that connection and say the connection is between the caseworker and the clients, and the interpreters are an important ingredient and aspect of the work of the agency as a whole, right? All right, Tigis, anything to add to that slide before we move on to any of the questions?
I think you've done a really good job of addressing some of the questions that have come up. I love that you touched on advocacy, since that was something that came up. Advocacy is a fuzzy word. I think interpretation itself is such an important role. One that we also want the report building to be there so that our clients could really feel comfortable to share. But how do we avoid that from, also, how do we stay neutral? How do we stay impartial from the role that we do? Some I love that you were able to sort of touch on those points. With that, and looking at the time, this brings us to the end of our training. We want to use this time maybe to answer some questions, maybe one or two questions that strikes maybe a theme for you, Rob. And we hope that some of your questions that maybe were brought up in the beginning when we asked you about the, what questions you have were covered in the content that was covered through the slide deck. But Rob, do you have anything that maybe strikes you as maybe a theme that you've seen in the Q&A box that have come up?
Yeah, one of the things that I identified and sort of touched on a little bit is this sort of like transmission of cultural information, right? Mm-hmm. And we talked about how if an interpreter is jumping to assigning a meaning or assigning like the cultural context for something without creating space for the client to advocate for that. But the question that I wanted to sort of highlight but shouldn't an interpreter do some of this is, doesn't an interpreter interpret cultural meaning and expressions and nuances rather than just words? Yes, right? And that's important about this idea of cultural brokering, that an interpreter is most effective when they also share cultural and linguistic background with a client, right? Now, what's important to note is that some things may be able to incorporate in interpretation, but there might be gaps, and it's important to acknowledge where the interpreter's knowledge of culture is helpful and where it might be doing too much legwork, or it might be going outside of the boundaries. Nice. So one really good way to screen for that in the middle of an interpreted meeting is to just have the interpreter pause and have a practice and protocol to check in with the caseworker and say, is this the meaning you're trying to get at? I want to make sure that I understand fully what you're saying before I interpret it. Or the client is saying this, and I'm wondering like what follow-up questions or what clarifying questions might be helpful here. So not just assigning a meaning, but creating space for curiosity and better understanding and clarification, because that's the goal, is getting the clear meaning across. But we also don't want to be making assumptions that overstep and take away the agency of a client that you're working with or robs them of their voice, because that's what an interpreter is supposed to do in empowering sort of practice of lifting up the client's voice.
Well said, Rob. And I think just adding on one last point to that is we could also use our meetings prior and our meetings after to gather some of that cultural brokerage that you talked about, right? This client had some reactions. Tell me more about that. How does that relay in the cultural context? Those are things that you could really use before and after to also get in the insight that is much needed for your role. With that, I'm so sorry to do this, but I think I'm just going to advance us to the next phase. And if we have a minute after, we might be able to take one more question. But again, thank you for all your engagement on this topic, all the questions that came up. We hope that you are now able to meet this learning objectives that we have set for you in the beginning of the webinar. And then next, we have some really great resources that I know Rob has mentioned for you all today to continue your learning, which we'll share with you in the chat shortly. But before we do that, please help us help you by completing our feedback survey. This survey is extremely important to us to help us improve our future trainings. We take your feedback very seriously and we want to hear from you. This should just take you a few seconds to complete it. It's just 3 questions. We're going to put that link, I think Rosalie has already put that link in the chat, and we're just going to give you a few seconds to complete it. You can also scan it from your camera. So I'll give you just a few seconds to complete it so that you can just go ahead and get that done. All right, well, thank you to everyone who completed that survey. This survey will remain open. We'll send the link out again tomorrow in our email for those of you who were not able to complete it today. Well, here are some of our list of recommended resources that we've been mentioning throughout for you to continue your learning. You are also going to be getting this and also a copy of the recording of the slide deck in the follow-up email within 24 hours. This concludes our presentation for today. Here is Switchboard's contact information. I do hope that you'll stay in touch with us and join us for future trainings. And of course, you can also visit our website where you can find all of our extensive resource library, recordings of all our past webinars, information about our upcoming webinars. You can also submit a technical assistance request if you need any additional support from us. On behalf of Switchboard's team, thank you so much for joining our training and all the work that you do. And a huge thanks to our speaker, Rob, for this amazing and much needed training. And of course, Rosalie, who has been behind the scene. Thank you so much. And I hope you have a great day.